So we have a patient, a typical case of a bad hair transplant. When hair transplant goes wrong, hairline was placed too low. Basically, the hairline is being placed at 5 centimeters for the eyebrows. We know for mature men that a hairline is usually a combination of two coordinates. We take the vertical line and the horizontal line. So in this case, his ideal hairline should have been placed here. So basically, from the glabella, around 7 centimeters from the glabella. So what we're going to do today is to remove some of those grafts that have been placed very low and put them in his donor where the donor has been over-harvested. Obviously, when we remove graft, we have to be mindful of not leaving a lot of linear scars. So one of the techniques that I use, I take one every other follicles, so then in the second session we can come and remove. So the goal is not to overdo it and not to overwhelm the ability of the scalp to heal itself without creating scarring. So the goal is here to minimize the scarring and make sure we remove all unwanted hairs. And later on, based on the aspect of the scalp, we'll see if we're not going to send him from some laser resurfacing. So the patient knows that it may take 2 or 3 sessions to remove all the graft and give him a natural hairline. Okay, so this is a patient, as I explained, that the hairline was placed very low, some area being at 5 centimeters to the eyebrows. So what we did, we shaved this part, so the hairline should start here. So we have at least a good 2 centimeters of shave area that we need to work on. 1.5 on this side, probably 1.5 on that side, and in the center forelock we have around 2 centimeters. So if we do a close-up, you can see some of those hair being placed, and you can see that you have 3 hair here, you have a 4 or 5. Here you have a pitting, so the hair was placed way too deep. You have a bigger hair, and most of them are standing like this. They're standing almost at 90 degrees. I know we're in bedroom in the land of Tintin, but not a lot of people have a natural hairline where hair stand at 90 degrees. So if we compare to his existing hair, his existing hair are not placed at 90 degrees. They're more likely to be around 40 degrees. So we'll work on removing some of the bigger one. It looks like they're very deep. So we'll start by that, and then we'll go our way, and the smaller one will leave them, but we'll focus mainly on taking the bigger boys today. So we'll start, it's already numb. We're gonna use a tumescent solution just to lift the skin up so we don't create problem on blood vessels. So the good question is, we don't know how deep these follicles are, but by looking at them, I'll set my depth at 3 millimeters to start with, and I'll put my guard at 3 millimeters. So we'll start with that, here I have 2, so I need to cut and add 1 more millimeter. I'm using a edge out punch from Dr.Trivellini. I like his punch, and but this can be done also with forehair Dr.Cole punch. Those are the main 2 punches that I use. So this is a test. We don't know. Okay, I have my light. Light on top. These are the grafts as they've been removed. So it's almost like we're digging potatoes. So the whole exercise is to make sure you get the full intact follicles, so then there is no way that the hair will grow back. So having tools like what we have, the 804 forceps, is something that I advise every hair transplant doctor to have. It's a Cole instrument. It's very good. It's like a crocodile. It has like a crocodile teeth, but that will not injure the follicles. It can allow good pulling and digging without injury the follicles, because the graft that we're taking, we're gonna put them back in a donor in a procedure that is called hair donor farming. So we're working, as you can see, the first step, keep it clean. Some of them are very close together, so we have to be careful. That's why also I'm using a small punch in order for this wound to heal properly and not leave any visible mark. But the key is to make sure you get the hair transplant right the first time to avoid this. So roughly this is the final look on the harvesting process. We have taken most of the bigger boys, and we leave some here just because I don't want to have too many linear scars. I may take this one because it's a little bit so. We'll put a healing cream, and next session can be scheduled in 8 weeks. Roughly it takes the skin 8 weeks to heal properly. So, but I'm happy because we have harvested a good number of those bigger grafts. So the hairline that he once had will not be the same. Still have some smaller hair, but now next session we'll look what is in between. We can take some, and then the third one will rebuild the proper hairline with proper size and type and direction of hair. So now we're gonna flip the patient, and gonna make the placing of this graft in the donor farming.
Thank you so much for watching our videos, and for more great content, don't forget to hit that subscribe button, and also go to www.bhrclinic.com and start your journey for a free assessment with Dr. Bisanga. Thanks ever so much. Let's get started together, and look forward to seeing you soon.